Hi everyone, it's Nurse Cathy. It's time for 5 on Fridays. Well, today we're talking about vaping, e-cigarettes, and smokeless tobacco. In 2019, the federal government raised the legal age to purchase tobacco products from 18 to 21 years old, and that was done as an attempt to lower the number of teens who are abusing tobacco products. Even with the federal government's attempt to reduce the usage among teens, the high school usage of smoking products has increased by 900%. And of that, there's been 2,800 hospitalizations and some deaths related to vaping, the e-cigarettes, and cigarette usage. Now, e-cigarettes are just as addictive as regular cigarettes. Now, there's over 5 million teens that have used e-cigarettes or vaping products in the last 30 days. And that equates to about 11.5% of our middle school children and about 27.5% of our high school students. Now, what is an e-cigarette? Well, an e-cigarette is a device that turns liquids into a vapor, and then the vapor is inhaled. These vapors can also be infused with such things as drugs like THC or cannabinoids or marijuana. Now, just as bystanders can inhale secondhand smoke from a cigarette, bystanders can also breathe in the products that are exhaled from the e-cigarettes. Now, what's the difference between e-cigarettes and vaping? Well, vaping products are generally sold in smoke stores, smoke shops, things like that. E-cigarettes are generally sold at gas stations and convenience stores. Now, vaping devices, they're not disposable. They can be used multiple times, and they have a whole array of different flavors that you can put into these vaping devices, and that really adds to the appeal of the vaping. Now, e-cigarettes are a one-time use only, and they have very limited flavor choices. Now, vaping and e-cigarettes are more expensive than regular cigarettes. Now, depending on your usage, you might spend, let's say you don't vape very much or smoke very much with the e-cigarettes. So if you use it minimally, you might spend on average of like $387 a year, all the way up to over $5,000 a year if you use it on a very regular basis. Now, how are e-cigarettes and vaping products packaged? Well, they're very clever. Manufacturers have been very clever about it. Some of them look like cigarettes, some look like a pen, and there's some that even look like smartwatches. And there's also vaping products that have been embedded into clothing, like sweatshirts and gloves. It's called vapewear. If you have a chance, Google it and take a peek. You'll be very surprised how clever they've got the vaping materials installed in clothing. Say, for instance, a hooded sweatshirt, you know where the cord usually is? Well, those are vaping devices that come out of the sweatshirt. Now, the most common device that's used here in the United States is a device which looks like a USB flash drive and is used by about 72% of the population. Within that device is a pod. Within that pod is probably equivalent to around 20 cigarettes. Now, the pod contains a nicotine salt called benzoic acid. It is turned into an aerosol for inhaling. Now, the product still causes irritations to the throat and lungs just like a cigarette would. Now, within these pods, they not only contain nicotine, but they can also contain such things as metals such as tin and nickel and lead. And also there can be marijuana or THC products within those little pods. And then also there can be food and skincare products that are also additives such as glycerin and the vitamin E acetate. Those products, especially the glycerol and the vitamin E acetate, are highly toxic to the lungs. Okay, so what are the effects of e-cigarettes and vaping on your health? Effects are similar to smoking cigarettes. The immediate effects are your heart rate goes up, your blood pressure goes up, and there's irritation to the throat and lungs. Now, the long-term effects is that you develop nicotine addiction, you have chronic lung and heart disease, lung cancer can develop, and also there can be fetal abnormalities for those in the childbearing ages. Now, there's also a new disease called EVALI. And I think there was a lot of press about that several months ago on the news with teens vaping and how sick they became, and some even died. EVALI stands for e-cigarette or vaping associated with lung injury. Now, it's an actual injury to the lung tissue. It's not an infection. Some of the symptoms that they have with this are the fevers, the chills, GI symptoms, and weight loss. Now, the Mayo Clinic studies have shown that the tissue damage that's caused to the lungs is similar to a chemical burn. Part of the treatment too is stopping the vaping and the e-cigarette use. Now, the healing begins with tissue repair, but the extent of the healing is probably in direct relation to the extent of the damage and also lifestyle. So now we said that vaping and e-cigarettes are mainly used by teens. So we think, okay, what are the effects that these have on our children, on their brains? Well, the immediate effects are they have happiness and a satisfaction from it. But the lasting effects are they're doing poor in school, they're having difficulty concentrating and learning, they have poor impulse control, meaning they're more irritable, they have more anxiety, and there's also greater use that they're going to move on then to future drug use and abuse. Now the bottom line is vaping and e-cigarettes are not safe. Your lungs are exposed to chemicals, and they're not an approved smoking cessation product. If you're trying to, say, get off cigarettes, they're not approved by the American Cancer Society, and they're not safer than the traditional tobacco products. Now, as a parent, my recommendation would be to familiarize yourself with all the many different devices out there, and be mindful of the objects and things that you see in your home. Be aware of who your children's friends are, what they're doing, and watch out for signs of possibly they're doing poor in school, they're irritable, they have a lot of anxiety and things. Just be mindful of things. Now, what about smokeless tobacco products? Now, smokeless tobacco products are where children and teens can experience tobacco products, but they can also lead to nicotine addiction. Smokeless tobacco can come in many forms also, such as chewing tobacco or spit, snuff or dipping, snus, or they also have a dissolvable tobacco products that look like candies and lozenges. Those especially are very dangerous with children in the house because children will mistake them as candy and they will ingest those, and it could lead to nicotine poisoning and death to a young child. Now, the health risks are the same for smokeless tobacco as would be with regular cigarettes, vaping, and e-cigarettes. Now, besides the obvious risks that we've already mentioned with smoking and vaping and e-cigarettes, they're still going to have heart disease, lung disease, and cancers when using smokeless tobacco. But the other thing that someone who uses smokeless tobacco can get is mouth and gum problems. If you chew or dip, there's a high rate of leukoplakia, and I hope I pronounced that correctly. And what that is, it's these gray whitish patches that form in the mouth. They really are almost like sores, and they can become cancerous. Now, besides all that, your tobacco products will stain your teeth, they cause bad breath, and they cause gum disease. Now, just as we spoke about e-cigarettes and vaping, smokeless tobacco is not an approved source to help people quit smoking. If you have a teen that has a nicotine problem using e-cigarettes, cigarettes, vaping, smokeless tobacco, whatever, there are resources out there to help your teen. One of them is Smoke Free Teen, and the other is smokefree.gov. So check those websites for help. I also want to remind you about another resource that you have available to you as a city employee, and it's available through the city and also your health plan, and it's called Quit for Life. And this is a smoking tobacco cessation program, and it's been very, very successful. It uses physical, psychological, and behavioral strategies to help you stop tobacco use of all forms. Now, within the program, you work with a quit coach, and you'll also have the ability to go to their website to obtain information, and they also have a mobile app that you can utilize too. Now, within the program, you'll have access to tobacco cessation products such as patches or medications, and many of those are available to you at no cost depending on what the product is. Now, this program is free. That's wonderful. It's a free program that's offered to all city employees and their adult dependents who are currently on the health plan. So please take advantage of it. Do something for yourself and do something for your family so that you can start living a healthier life. Now, that's all from me today. Monday, I want to remind you, Monday, Ashley will be with Beyond the Table, and she's going to talk about coffee shop alternatives. So take care and have a great weekend.